Not safe for work. Gynecologists and urologists of Reddit. What are your horror stories? Literal first day of my internship. We started with a gyn and were told we can see an emergency uterus evacuation due to an incomplete abortion. So we get to the ward and the patient is just on the bed, all stirruped up, no anesthetics, nothing, and the doctor is just in the business end with forceps removing the tissue that was left behind while the patient is writhing in pain. Great introduction to gynecology. My vagina just rage quit. Your uterus too, probably. I had a surgical abortion and I would not have made it without some serious mental scarring if not for God's greatest gift when your uterus is being scraped from within. Morphine. So I was a MA for a urologist. First day talking with patients on my own. This lady was on a drug for incontinence and my job was to ask about side effects, with one possibility being constipation. When I asked, she said, "Oh yes, I didn't poop for 4 days. I finally just had my husband dig it out with a spoon." The long pause on my part encouraged her to continue with, "I bled a little after. Do you think that was from the med as well?" "No, pretty sure that was the spoon, but let me get the doctor." I had endless stories during my short tenure there, but that one really challenged my ability to keep a straight face. That is a husband that really loves her to scoop out her poop with a spoon. A real pooper scooper. I'll see myself out. Not a doctor, but a patient once. I had my peanuts circumcised when I was 23. While the nurse was injecting the anesthesia, my doctor, who is a friend close to my parents, grabbed the urology book and said, "I always wanted to make this surgery, but it is so complicated. I will take a look on this step by step to make sure." I just remember saying, "What? You are joking, right?" and slept. Woke up wondering if the surgery actually happened, because I couldn't feel a thing. That man is a comedy god and I aspire to be as adept at tomfoolery as he was. Just to clarify, couldn't feel a thing meant what? He lost his penis. When I was an intern rotating through a local OB/GYN clinic, there was a woman requesting that her IUD be removed due to foul odor for over 3 months. Typically foul odor is not associated with IUDs, but ultimately she wanted it out. She stated that multiple partners refused to be with her due to the smell. Her 5-year-old daughter even said that her mama's coochie was stinky, inserted the speculum and found a used tampon lodged deep in there. She forgot it was inserted up there and had had multiple periods. It was the foulest smell I have ever smelt. We took the IUD out at her request and sent her on her way. She's lucky she didn't die from toxic shock. How didn't she die though? What? Good friends of mine is a gynecologist. He said this one lady came in due to a foul odor and pus was seeping out. Apparently she was using a dildo and she must not have used lube or something, because when she first put it in it made a small cut, scratch. Well, that dildo had some bacteria on it and it was in the cut, slash, and it got infected. He's only been doing it for 9 out of 10 years, but he said that's the worst he's seen so far and he hope it never gets worse than that. That's why you always run it through the dishwasher after you use it on your ass. When I first started out as an EMT, we got a call for an unknown medical call for a female in her early teens. We roll out and get to her house and are greeted by her mother, who told us her 14-year-old daughter was having vaginal pains and was in a lot of pain, so after doing the workup we load her up and take off for the hospital. Now that we're on the way to the hospital and away from mum, the girl starts to open up to me and tells me the real cause of the pain is she was using a mini vibrator and while going to town lost her grip and it slipped inside her and out of her. She tried in vain all afternoon to retrieve it, but only managed to push it in further. That combined with vibration settings set on high, she started to have searing pains and just couldn't take it anymore and called 911 and told her mum it was vaginal pains. They ended up having to take her to the OR to get it out. That's how far it went in. Kind of late, so this will probably get buried, but resident doctor here, though not an OB/GYN resident. In my OB/GYN rotation in medical school, I had a case that I thought was the worst case of bacterial vaginosis I had ever encountered, based purely on the smell when conducting the pelvic exam. I didn't see an abnormal amount of discharge during the speculum exam and I noticed the smell got stronger as I moved away from the patient when completing the exam. It turned out the smell came from the patient's feet, which were on the stirrups and in extremely close proximity to my face while conducting the exam. Anesthesiologist here. We do OB all the time. Stat C-sections are the most horrifying thing you can imagine. Usually it is because of severe fetal distress, and in some cases we don't have an epidural to dose up, so we need to do an emergent induction general anesthesia, which is a nightmare in pregnant women. Their airway is edematous and everything you touch starts bleeding profusely. The way that pregnancy affects the respiratory system is that it dramatically reduces their pulmonary reserves, so you have maybe 30 seconds to a minute to get a tube in before mum starts to turn blue. All the while you have a fetus that is getting more and more unstable. Thankfully they are rare, but in 2 instances I had a stat in a mum who had come in for preterm labor and the kiddo was just viable, around 28 weeks. Both babies died, and both moms woke up asking if their baby was okay. Those were rough days. I'm a nurse. This wasn't my patient, but happened during a shift I worked. The worst thing I saw was this pool woman who came in for a D&C after her 12-week fetus was found to no longer have a heartbeat. She came in as an emergency case and was planned to be taken to theatre in accordance with normal emergency theatre triage. We were told to get her ready, and she was giving medication to cause uterine contractions and attach the placenta. Unfortunately, after the medication was given, a more pressingly urgent case arrived at the hospital and she was bumped down the list. She wailed and labored, and gave birth to her tiny dead baby on the surgical ward. Doctor of a different sort here, veterinarian, with a gynecological story. A fellow vet I knew well went out to examine a ewe that had failed to get pregnant twice. The first thing she noticed on exam was that the ewe's vulva had fecal staining around it. The second thing she quickly noticed was that the ewe lacked an anus. This sheep had been born with anal atresia, lack of an anus, and somehow the owners had never noticed. If this isn't caught and corrected, it's almost always incompatible with life. In this rare case, however, the ewe managed to survive, because a rectovaginal fistula had formed, and it had spent its entire life defecating out of its vagina instead. Needless to say, this wasn't particularly conducive to pregnancy. Okay, I seem to be the only urologist here. You want horror? Look up T-shunt for priapism on YouTube. Have fun. As a group of med students we were sharing medical placement horror stories. This one lady comes into her gynecologist saying that she's been having discharge between her periods. She has no idea what's wrong. They go to do the physical exam and notice that her discharge is black and has a noticeable odor. Doctor thinks they can see something at the end of the speculum. They ask if it's possible that she's had a tampon that hadn't been removed and she says no. But turns out she had started her period a month ago without any sanitary products at hand and decided to use a piece of potato as a tampon. Naturally the piece of potato got stuck, but she was too embarrassed to mention it. Cue the removal of a month-old piece of black, moldy, bloody, rotten potato and immediate disposal. I don't think she came back for follow-up, but is hopefully fine. Lesson of the day. Don't insert vegetables into any bodily orifice you can't get them out of, not just the usual one. Oh fork, yes, I finally have one. This is my great uncle's story. He was working as an OBGYN in Amish country. It was pretty routine work. Not a lot of exciting stuff happens in the boonies. One day, a middle-aged Amish woman comes in, maybe in her early 50s. My uncle meets her in the exam room, where she very sheepishly says, "Dr. Pants, I have leaves." Confused, my uncle asks for more information. Her face turning a deep purple, she gestures to her pelvis and repeats, "I have leaves." His nurse helped her into the stirrup chair and Uncle Pants began the pelvic exam. She had leaves. In her vagina, there were leaves. Goddamn leaves. Turns out, an old folk remedy to prevent uterine collapse is to shove a potato up to the cervix. The potato had sprouted and leaves were growing out of her vagina. I guess vaginas are fertile environments for potatoes. Not a doctor, but I heard a story a few years ago. A guy was having surgery or a vasectomy or something like that. He was asleep and the doctor and nurse were making fun of his peanuts and making fun of the guy. The guy heard a recording of it and sued. Don't remember how much he got. Wound nurse, not a urologist, but plenty of horror stories. A guy made a cock ring out of the ring on a bottle of pop. Did a lil meth. Passed out. Left it on for 36 hours. Looked like the eggplant emoji. Swollen and purple, with a green ring. He surprisingly ended up keeping his peanuts, but had to have skin grafts when the necrotic tissue sloughed off. Happens less often than foreign objects up the ass, but more common than I'd hope. Men with chronic catheters often end up with urethral erosion that splits the glands. Calciphylaxis. Blood vessels harden and die off. Happens in chronic dialysis patients of a peanuts that mummified it until it fell off. Poor guy was on hospice by the end of it. Calciphylaxis is usually an end-of-life condition. Foreigner's gangrene is a real NSFL Google search. Necrotizing fasciitis of the groin, common in diabetics. Usually start with multiple debridements, wet to dry dressing changes, and then move to a wound vac. Usually the scrotums end up open and you have to be careful how you dress the testicles to prevent the vac from sticking, but the women are the hardest, because the labia are hard to keep a seal on. Once a guy with fluid retention in his scrotum, size of a child's soccer ball, tripped, fell, and it burst open. That made me cringe.